under the theme Water and Gender, highlighting the importance of changing the narrative and tackling systemic inequalities and promoting equity and equality, especially for rural communities, and particularly women and girls who continue to suffer disproportionately when it comes to access to water and sanitation services, as it were. So for this year's theme, there are particular things that this year is emphasizing as we reflect on this. And the focus is really on empowering women and girls in water management, sanitation and hygiene to ensure equal representation and opportunities as well for the women. But much more, the significance of this campaign is that women often bear the burden of care when it comes to actually collecting water, taking care of people who are sick, and we see that they do quite a lot in this regard. So the campaign message for this year is very simple. Where water flows, equality flows. And we see this encouraging us to creating a much more prosperous, gender equal future by ensuring that women are leaders and are also decision makers in championing and articulating water solutions across the country. And essentially, March 22nd, which will be on a Sunday, the objective will be to ensure that we address these systemic inequalities and also the underrepresentation of women in water decision making across the board. And here we are delighted that we also have the Managing Director from Northwestern Water Supply and Sanitation Company, who is one and the only female MD amongst the commercial utilities, which is also something that we are appreciating as we reflect on this year's World Water Day. But much more importantly, the Global Water Aid Federation today is also a special day for us as we also pause and reflect and also launch a campaign that we're calling Time to Deliver campaign, which really reflects on issues around WASH for women in healthcare facilities, resonating much more with this year's World Water Day theme, as it were. So to kickstart our conversations, I will, at this point in time, call upon the Water Aid Country Director, Ms. Yanko Mataya, to come and give us her opening remarks. Thank you.
Good morning once again, ladies and gentlemen. I'm not sure. I think there's been enough time for the systems to boot up before the day has started. Good morning once again, ladies and gentlemen.
Good morning.
Thank you very much. If you may allow me to recognize the presence of our Director for NWASO, Engineer Kelvin Chitumbo. Let me also recognize the presence of the Ministry of Water Development and Sanitation, the parliamentary committees. Let me also recognize the ED for Western Water, Country Director for Border, together with all of the stakeholders that have taken time to join us here this morning. I'll ride on the protocols that have been observed by our Master of Ceremonies. This day is possibly a very special day for us in the sector, and this week indeed is a week that is very special for us in the sector. And it becomes a special day, a special week, a special month, and a special time of the year for a number of reasons. First and foremost, I'd like to invite the women just to give a round of applause because it happens to be March, which is Women's Month. So please, a round of applause for Women's Month. For the amazing work and the amazing roles that women play in the professional domain and, of course, in the personal domain as mothers, as aunties, as sisters, and whatever different roles that we play in churches and so on. So women, thank you so much that in addition to being all those other things in those spaces out there, we can also come into the spaces here and be the powerhouses that we are. Madam Punga, who is there, Angela, our ED for Western Water. This is why Women's Day is there. It's for women like me and for women like you who can stand as examples to model for many others out there that are looking up to us and looking forward to one day occupying the same spaces that we do occupy. Such being the case, I would say that it's then also very valuable the fact that Women's Month then falls into the same month that we celebrate possibly a resource that is the closest to women than any other. Oxygen, all of us share oxygen. I think that's no more the air that we breathe and the food that we eat, but water is a resource that is possibly the closest to women. Close to women in terms of meeting of our personal needs as women, close to women in terms of the roles that we play in our families, in our communities, and in our work. Close to women because water can actually be the line between life and death. And close to women because water can also be the line between exploring your full potential and never exploring it at all. So to the whole room, I invite us to again give a round of applause for the fact that it is a month that we celebrate water, a resource that is very close to women. Please. When we come to for today, it then is a really good time for us here in Zambia to come together and have this conversation around in the water sector, to talk about women's leadership and governance and what the past, the present, and the future mean for where we want to be in as far as access to water is concerned, especially for women and girls. I will write a lot more on the campaign that WaterAid has recently launched. If you have a moment, you can take your phone. There is a QR code in that corner, and there's a QR code in that corner. It's called the Time to Deliver campaign. And I will take a moment to put that campaign into context. Globally, we find that water, sanitation, and hygiene is very closely linked to delivery of quality health services, to the delivery of education, to us having healthy communities, to us having functioning institutions. All of those things depend on having access to water. We have specifically picked Time to Deliver, focusing on healthcare facilities, for the reason that the time that women are giving birth is probably one of the most vulnerable times that they experience, but it's very sad that when you go around and you come into Zambia, for example, at least 1/3 of healthcare facilities are operating without safe, reliable water, are operating without adequate provisions for sanitation, without adequate provisions for hygiene. This is just the reality, and we know that WASH actually is a key determinant for maternal health outcomes. We have in this country as many as 187 women who die out of 100,000 women who deliver. They die because of many things, and sepsis is one of those reasons. The key driver for sepsis is actually cleanliness. It's good hygiene, it's effective infection prevention and control, which is otherwise not possible if water, sanitation, and hygiene are not made available. So we have made a commitment to say that we want to see every delivery be a safe delivery, because there is no mother who deserves to die or to be afraid to give birth in a facility that does not have water, sanitation, and hygiene. Some of the stories that we have heard from this work include stories of women who deliver today and spend a day and a half or 2 days in hospital without a bath. And so they spend those 2 days no bathing, and they can only go and bath, they can only go and change clothes when they get home. I'm not sure that in the 21st century this is acceptable. That being the case, we have then an opportunity as people, as women in this room, to be the ones that make a difference. And how is that difference made? It's by committing to take action, making access to the services available in the healthcare facilities, but it also in amplifying, giving the campaign a voice, giving women a voice who otherwise don't have the opportunity to do so. Zambia is a vast country. Our mother in Mpulungu may never have the opportunity to find herself in a Taj Pamodzi meeting in Lusaka. But because we here understand the challenges, have the opportunity to speak on her behalf and to give her the voice that she ordinarily would not have. The mother in Sesheke as well may never visit Lusaka, but this campaign is going to give her a voice to be heard and for the challenges to be addressed. So we are looking forward to seeing everybody in the room commit to deliver life, because it is time to deliver. And I'm also looking forward to seeing all of us committing overall, moving forward to something that we are going to do differently, something that we are going to start to do in order to accelerate the SDG 6 agenda, specifically access to clean water, sanitation, and hygiene. We are just a few years away from the ending of the Agenda 2030. We are in the final year of our 8th NDP. I believe all of us had hoped that we would have made much further progress, but sadly that is not the case, and this conversation is to trigger us to think about how that is going to happen. So thank you so much, everybody, for sparing the time today, and I hope that this meeting is an opportunity for that deep reflection and an opportunity for making those commitments that make a difference for everybody out there that does not have the privileges that we do. Thank you very much.
Things in her welcoming address. I have the privilege of inviting Engineer Chitumbo to come also and give his remarks. Let's give him a hand. Thank you.
Good morning. Good morning.
Good morning.
Okay. So let me recognize the representatives from the Ministry of Water Development and Sanitation, the Water Aid Zambia Country Director, Ms. Mataya. Let me recognize the Director General for Border, the MD for Northwestern Water and Storage, Northwestern Water and Sanitation Company, staff from NWASCO, representatives from the vocation training colleges, representatives from the Resource Development College, representatives from Lusaka Business and Technical College, our friends, the media. Allow me to simply say, ladies and gentlemen. May I begin by expressing appreciation to our partners at Water Aid Zambia for collaborating with the National Water Supply and Sanitation Council to convene this important discussion forum as part of the national commemoration of World Water Day. Ladies and gentlemen, this global observation, which actually is commemorated annually on the 22nd of March, reminds us of the critical role that water plays in the human health, dignity, the economic development of the country, but it also provides an opportunity to reflect on the progress we have made and the technical challenges that remain in ensuring sustainable and equitable access to water and sanitation. The 2026 theme, Water and Gender, calls for a transformative and also right-based approach to water governance that ensures women have an equitable voice, leadership and opportunity in shaping decisions that affect water resources and service provision. In Zambia, access to safe and sustainable water supply and sanitation services remain a critical development priority. Progress in this sector directly contributes to the achievement of the Sustainable Development Goals, particularly SDG Target 6.1, which calls for universal access to safe and affordable drinking water, and also SG Target 6.2, which aims to ensure equitable sanitation and hygiene for all while ending open defecation. Equally important is Sustainable Development Goal number 5 on gender equity, which recognizes that sustainable development cannot be achieved without full participation and empowerment of women and girls. Despite the progress made in expanding water and sanitation services across the country, access gaps remain, particularly in peri-urban and also rural communities. When these gaps occur, it is the women and the girls who often bear the greatest burden. In many households, they are responsible for collecting water, managing sanitation and hygiene, and also caring for family members affected by waterborne diseases. Yet, despite this critical role in water management at households and also community levels, women remain unrepresented in leadership and decision-making positions across the water sector. From a sector governance perspective, it is important that we acknowledge both progress and also the gaps that remain. Ladies and gentlemen, across Zambia's water institutions and commercial utilities, women continue to make valuable contributions as engineers, planners, regulators, scientists, and community engagement specialists. However, their representation at the highest level of institutional leadership remains limited. At present, as we've already heard, among the Zambia's 11 commercial utilities, only one is led by a woman managing director, who's here, which is a collective of the Northwestern Water and Sanitation Company. This statistic obviously illustrates the broader structural changes that the sector must confront. It is not a question of capacity or capability. Women across Zambia have demonstrated the technical competence, leadership ability, and also strategic vision required to manage complex water and sanitation systems. The challenge lies in strengthening the leadership pipeline, ensuring that women entering the sector are supported through mentorship, development, and equal opportunity to progress in senior management and executive positions. Evidence from across the world shows that inclusive leadership strengthens institutions and improves service delivery outcomes when women participate meaningfully in the water governance. Community needs are more accurately reflected in planning, processes, accountability is also strengthened, service sustainability improves. For this reason, advancing women's leadership in the water sector is not only a matter of equity, it is also an essential and also for effective governance and better service delivery that is required. Ladies and gentlemen, as a regulator for water supply and sanitation services in Zambia, NWASCO remains committed to promoting governance standards that strengthen accountability, transparency, institutional performance across commercial utilities. And part of this commitment includes encouraging and guiding institutions to build inclusive leadership structures and organizational culture that recognizes the value of diversity in decision making. Today's forum, therefore, provides an important platform for reflection and also dialogue. It brings together policymakers, regulators, utility companies, development partners, civil society organizations, our friends in the media to explore a critical question: how can we strengthen women's leadership and also participation in water governance in Zambia? I am particularly encouraged to see students and young people in the audience today. The future of the water sector will depend on the next generation of professionals who choose to change or to choose careers in engineering, sanitation services, water management, environmental science, regulation, and others are related to water. We must ensure that young women and girls see their water sector as a space where they can lead, innovate, contribute meaningfully to the national development of our country. Ladies and gentlemen, as we engage in today's discussion, may I encourage all the participants to focus on practical outcomes. Let us identify the structural barriers that continue to limit women's participation in water sector leadership and explore the reforms and commitments that can help address them. If we succeed in doing this, today's forum will not simply be a commemorative event. It will be a platform that helps shape a more inclusive, effective water sector for Zambia. In closing, allow me to reaffirm the commitment of NWASCO to working with government, commercial utilities, the civil society organizations, cooperating partners to ensure that Zambia's water and sanitation services are not only sustainable and efficient, but also inclusive and equitable. When women lead in the water sector, communities benefit, institutions become stronger, and our country moves closer to achieving sustainable development for all. I thank you, and may God bless you.
We can do better than that. Let's give him Thank you. Quite a number of important things that have been highlighted in that address. And to put that into context, we will now have a presentation from the Ministry of Water Development and Sanitation, which will be led by Dr. Selenya, reflecting on gender equity in the water sector and the concerted efforts that governments continues to undertake to promote female participation in decision-making in the sector. Please, let's give a hand of applause for Dr. Selenya. Thank you.
I'll ride on the protocols that have already been observed and go straight into the presentation to open up the discussion on gender equity in the water sector. So, efforts by government to promote female participation in decision making. Government is committed to ensuring all citizens have access to clean water and adequate sanitation, and also hygiene services. And this is regardless of age, gender, economic status, or disability. So we align with Sustainable Development Goals. Number 1, no poverty. 5, gender equality. 10, reduced inequalities. And of course, our main SDG target, clean water and sanitation. equity and inclusion in WASH services. We need to acknowledge that gaps still exist in the quality and uniformity of WASH services, and this has repercussions on the most vulnerable. Those impacted the most are children, female-led households, adolescent girls, persons with disabilities, refugees. You find that they are impacted more with the quality of service, when the quality of service is poor. So inclusive WASH delivery for vulnerable groups may be further compromised by other external factors, as we've observed, situations and emergencies. Not so long ago, we had the drought. We have had floods in certain parts of the country. We had the COVID-19. We had cholera outbreaks. So you find that the most vulnerable are the ones that are impacted. So we need a more consolidated approach to WASH programming, and this, of course, includes gender considerations. What are the gender issues? I think these have been mentioned by the speakers that have come before. So we have low participation in WASH services and decision making, and this is by women. Low access to WASH infrastructure. We're talking about water points, toilets, and washing facilities. So this contributes to the disease burden, and we also see that women bear the most burden of collecting water, so they are impacted the most. They spend less time on economic activities because they have to collect water for the households. We also have institutional barriers, so these cut across from recruitment to promotion to retention. And we look at mostly technical fields like engineering. Then so this contributes to poor advancement of women in the sector. We also have inadequate menstrual hygiene management services, particularly in schools. This affects girls' attendance. And when you look at healthcare facilities also, it affects our mothers who go there to give birth. So at policy and institutional level, of course, we have provisions, the Gender Equity and Equality Act, where we also find the definitions of gender, which speak to roles, duties, and responsibilities which are culturally or socially ascribed to women, men, girls, and boys, and also equity, which is the just and fair distribution of benefits, rewards, and opportunities between both sexes. So we also have the 1997 Water Supply and Sanitation Act, which is under review. In the current act, gender is not very explicit. So these are some of the things I think even in the review that needed to be looked at. The national gender policy, the screen has gone off. Maybe I touched the cable, okay. The national gender policy, which is our main guide on gender mainstreaming. So it promotes equality in WASH services, that is increasing women's access to services and participation. Our 2024 water policy also, which talks about gender responsive WASH, the WASH Equity and Inclusion Guideline, which we formulated with support from our partners WaterAid and UNICEF. This guideline looks at, promotes equity and inclusion, looking at gender, disability, and also other vulnerabilities like emergencies that can occur. And also our FNDP, which also promotes inclusive WASH services. So at community and institutional level, to promote such participation, we have a number of platforms that where key issues are discussed, are planned, budgeted for, and we also monitor our implementation. We have the WASH Technical Working Group, where government ministries, agencies, our partners are part of, to ensure that our implementation is all inclusive. And issues of equity are also overseen in such platforms. the WASH Emergency Response Cluster, which has been quite helpful in managing emergencies like cholera. We also have the Presidential Initiative on Waterborne Sanitation Facilities in public institutions. So there's also a platform there that oversees implementation of this initiative. It's basically to ensure that in public institutions, especially schools, we have waterborne sanitation facilities that are inclusive and where issues such as menstrual hygiene management are also catered for to promote girls' attendance in schools. The Skills Advisory Group, also co-chaired by the Ministry of Technology and Science and our ministry, Ministry of Water Development and Sanitation, whose secretariat is NWASCO, promotes WASH skills and also has a special focus on the girls to ensure that girls get into the technical fields, that they are provided with an opportunity to practice through internship programs and also awards. So that one is also a very good initiative that promotes women's participation. So gender analysis audits also are carried out. Mostly when we've done this is through the support of our partners. We hope as a ministry to advance this as well. But we did an audit, did another gender analysis in 2022. This is basically to look at the issues, barriers, gaps, and opportunities that exist in the sector. So these are some of also ways that we know the issues that are occurring that affect people out there. And also engaging and involving various groups at community level in program design, planning, implementation, monitoring and evaluation. And this is done through our two national programs, the National Rural Water Supply and Sanitation Program. And in there, you will look, there are community structures that are available, have been formulated, the village WASH. At district level, you also have the district WASH, and at provincial level, the provincial WASH. So these are also platforms that promote participation. Then the National Urban Water Supply and Sanitation Program, which of course looks at the urban and peri-urban component of program implementation. So in the development of infrastructure, we also promote participation through the structures that I've also mentioned, and it's also to ensure that we bring the resources closer to the people. And when we do that, women benefit. In schools, we have a technical working group for WASH in schools, which was, of course, is led by Ministry of Education. And this looks at minimum standards for WASH in schools, and also issues of menstrual hygiene management, disability, ensuring that we have services for the learners. In healthcare facilities, similar situation. We also have a technical working group for WASH in healthcare facilities. Actually, this week there's a meeting going on for WASH in healthcare facilities. We have minimum standards that have been set also, and it's also to ensure that the services are appropriate and are close to people. So lastly, it's how we move forward to ensure that we promote equity and inclusion. It's important to collect data. Evidence is very important in program implementation. Also use the twin track approach. When we provide services that also take into consideration the needs of the most vulnerable, the needs of the women, then we are able to reach everyone. Then targeting interventions and also engaging and involving target groups, ensuring that we are monitoring our progress and also promoting and developing accessible information services and facilities for vulnerable groups using universal designs where possible. So this is what I wanted to share with you as we go into the discussion. Thank you very much.
Thank you, Dr. Selina, for that overview and providing us with the national architecture when it comes to equity and inclusion guidelines, but also much more focusing on our gender framework for the country, especially in the water sector. At this point in time, we will not have any engagements to ask, but I think when we will have the panel discussion, there will be that opportunity for all of us to engage with the panelists to delve deep into some of these aspects that have been highlighted. We have a robust policy framework, everything is well laid out, but where are those gaps that continue to hinder progress when it comes to women participation, especially in the water sector, but much more also in terms of access to decent, adequate, and quality services, especially for those girls and women in rural communities. At this point in time, we'll have a short interlude of a video from the Time to Deliver campaign, just to provide context in terms of the realities that women continue to face in our settings, especially in healthcare facilities, especially those that continue to be burdened by lack of access to adequate services. So, just a disclaimer, as we set up, the video is sensitive, so for those that are sensitive to imagery from healthcare facilities, please, we do also ask that if you're not comfortable, you actually can leave the room, because it shows the realities and the things that are going on in our communities. So just trying to put that disclaimer forward as we begin this. After the interlude of the video, we will then get to a presentation just to provide an overview of the context of why this time to deliver and why it's time to deliver actually, to ensure that WASH is a key topical issue. Please, I will ask that maybe we dim the lights and then we can play with the video. Thank you.
Makabiri na kuti kodi dzakhala moyo kapena mwana ni kumudikirira yadzakhala wa moyo kuti sinangaba makhala kuti tili pakati pa moyo ndi imfa. Sikamishima tukuya kuti kadi nyungu simachikumbirega kuti ngopezani napo mangezani mtendera nongoshika mbeza nawo pezani mtendera.
Sorry for that. If someone could just check for me if there's anything wrong that side. Thank you, Eddie.
So saying this is okay, it's not how it's so good. The equipment of the power in the US and the two. Now I know kind of. I want you to be biggest number one who got into the US. But one time I had, you should have was not that did it carry mine, carry mine. Because when Sula was not doing one of that, exactly was not Gala. So when I moved that, I didn't never find out to be coming again. She began to walk around for me. She was there. That's why you was a way that is when I said it's about me. barabwesa uli msangala ni mwana wangu alimana sangalati ndawamona basi utunarete.
Thank you so much for your kind attention to that video. So that's a video around the campaign that we have that we're calling the Time to Deliver campaign. John, if you could just kindly help with the light again, bringing them on. So my name is Angel Piri. I'm Communication and Campaigns Officer at WaterAid Zambia. And I'm just going to go through what the campaign that we've launched this week is called and what it's all about. We're calling it the Time to Deliver campaign. And the video that you watched was produced from various country programs of ours. Some parts were in Malawi, from Southern Africa. We have some parts also from Western Africa, and as well as Nepal. But what we can see from everywhere is that the realities are the same, especially in low to middle income countries. Well, as we know, the 22nd of March every year is World Water Day. According to the UN calendar, Zambia is party, like many other countries, to the UN calendar. This day initially highlights and is focused on raising awareness around fresh water and as well as the sanitation challenges that exist in communities in Zambia, in regions like Southern Africa, on continents like Africa, and also globally in many other places. So this year, the theme, as we know, is around gender and women, and it could not be more overemphasized how water and sanitation really are a basic human right. And with the theme that we have this year, which is linking water and gender, we do see a connection between how we should pause and reflect in how we actualize SDG number 5, which is focused around gender equality, and also SDG number 6, which is concerned about access to water, the universal access to water for everyone, everywhere. Now, even as we reflect on this and we look at the issues that still exist, we do still see to say there are many key issues that still have women at the center of them. For instance, around water, women still bear the burden of having to collect water in many communities. This takes away the time that they would either be productive, that they could pursue their aspirations, and sometimes this also poses as a harm. Women as well, like we saw in the video that we just played, do face greater sanitation challenges, even when it's time for them to deliver in healthcare facilities, when it's time for them to be attended to. We saw how the lack of wash in these facilities and many others that we've come face to face with and sometimes also have experienced ourselves on the lack of wash and how it's affecting women in these areas. And clearly also, like has been alluded in many of the speeches that we've heard of everybody that has spoken before me, is how most of the water challenges are often less involved, women are rather less involved in decision making around some of the water challenges that we know. While this is the moment that we do reflect on the challenges around challenges in the water sector, we do know to say at global level the UN is gathering at the UNESCO office in Venice, where we hope and anticipate to see the report, the World Water Report on that's being titled Water and Gender, where water flows, equality grows. And our expectations couldn't be more higher in regards to see what changes this will mean for women, what changes this will mean for WASH in healthcare facilities. So we hope to see dialogue, of course, in Venice on Monday. We hope to see a lot of action also and commitments around how we will accelerate change for WASH in healthcare facilities, especially as to how women and as well healthcare workers are taken care of. But our core message still remains the same. Access to water is indeed about dignity, equality, and also opportunities for women. At the same time, inclusive WASH systems are key to empowering women and girls in our communities. It's under this same breath that WaterAid came up with this campaign that we're calling Time to Deliver. So it's twofold. On one end, of course, in the literal sense, time for women to deliver, but on the other hand, time for action to be delivered in a way that we have women at the center of being prioritized, healthcare workers as well, so that clean water is accessible for every birth that happens at every facility, anywhere, either in rural settings or as well in urban settings. But the reality is on the ground, and when we try to picture what really happens and what is existing, when hospitals and clinics don't have access to clean water, it really puts the lives, especially of women and the babies that are born, at greater danger. There's danger for many other people, but these are the people who are most at danger when this is the reality in an institution. So women and girls, and especially children also who are born in these facilities, have unique needs that need to be met. And investing in WASH and also ensuring that there's access to clean, sustainable, and safe WASH facilities in these facilities will ensure to say that we are able to protect these lives. Yet when we see statistics of reports that we've done and research that we've found, every 2 seconds, women in at least the least developed countries die giving birth in healthcare facilities, which are avoidable deaths as a result of not having adequate access to clean water and also clean WASH facilities. Every year also more than 1 million women and newborn babies lose their lives in a preventable way. And this is really linked to infections, linked to unsafe births that happen in such facilities. It's also staggering to note that while women from the front line make up 90% of people in the front line of healthcare service delivery, only 25% of women are at the center of actually leadership roles in this regard. A simple example I would give, and just to show that this is not only a problem unique to a country like Zambia or in communities that are underserved, is an example from a country like Ghana. And this is a confession of somebody called Sambo. After labor, I had no clean water to clean myself or the baby. I had to stay overnight and could not wash after giving birth until I went home the next day. Now, while this may just sound like a quote which is on a PowerPoint presentation, it's the reality of women in communities around the world, especially in least and middle income countries. So our goal with this campaign is that by 2028, we want to see a powerful movement led by women and allies that will have made the lack of WASH in healthcare facilities impossible to ignore. So women's voices most of the time are often overlooked, sometimes don't have the power to be heard, and don't have the visibility. But through this campaign, we are fronting the voices of women, we are fronting women themselves, and organizations like WaterAid are now playing a role of being allies. And we're looking for support and partnership also from other allies who will help to bring conversations, who will help in opening the space around women being fronted and these issues no longer being able to be ignored by decision makers at every level. And this we want to see lead to tangible policy changes in the funding and as well that could transform the lives of people. So the changes we want to see are threefold, and I'll quickly go over them. We want to see more political commitment from our governments, from women-led groups, on how we're going to improve the situation of WASH, especially in healthcare facilities. We want to see costed roadmaps. We want to see this reflected in our budgets as to how we are going to finance access to wash in healthcare facilities. We also want to see better budgeting around this, better budget tracking as well. And for many key indicators, mother, newborn and child health, sexual reproductive health rights, including the budget coding for this. So our mission with this campaign is really to make healthcare safer for every woman and girl by calling on governments to provide clean water, decent toilets, and good hygiene to healthcare centers everywhere. These are just some statistics from the report that has just gone up today by WaterAid. It's been done in Sub-Sahara as well as in Asia. And it shows you how maternal sepsis affects women. So we can say where there's 20,000 cases of maternal sepsis cases, we see there's less deaths if there's wash. But when there's no wash, the numbers double. So by investing in wash in healthcare facilities, we're able to prevent some of these deaths. But then also, why do we have this campaign, and why is this something that we should even take forward and bringing the voices of women? It's for many reasons. For starters, change has not come quick enough. Change has not led even to significant change that we would love to see. In 2019, as you may recall, the UN resolution on wash in healthcare facilities, there were commitments made at the highest level by governments, by stakeholders, on how we improve wash in healthcare facilities. The G20 again met in 2024, and commitments were made, meaning there's a realization to say these are issues that need to be addressed. But how come in a time like this one, we still see to say access to wash in healthcare facilities is still something that's lacking? It's still one of the biggest challenges. These are things that we're trying to help change by this campaign. Commitments are there, but then there's usually shying away from these commitments for other priorities or for many other reasons we may not know in this room or be privy to. But what we want is to garner support and make women's voices louder, in a sense that even where commitments are made, we're able to say the voices are loud enough. How come there's no change that's coming through this? So the demands of women are really clear at every level, at national level, at local level, at regional level as well. So this year, as we know to say, the UN Water Conference happens in December, starting on the 9th of December in the United Arab Emirates, and it will be co-hosted by Senegal. So this conference marks exactly 3 years before the end of the SDGs as we head towards 2030. SDG number 6 is one of those that's also off target. And one of the expectations as world leaders, as governments, as countries go to this convention is to see commitments we're making on how we still achieve our goal on SDG number 6. So through this campaign, we want to ensure to say we are creating that demand, because ever so often when you hear it from funding organizations like the World Bank, like AFDB, there's usually calls and statements to say there's no much demand around financing for wash, financing for wash in healthcare facilities also. But if we are able to raise this demand, we want to see change that is not able to be ignored. So our target audiences for this campaign are twofold. One is the audiences to mobilize. So really it's focused and fronted by women who have lived experience as well as girls, especially also healthcare workers. Their allies also around the world in communities, including civil society organizations and individuals as well. The audiences we seek to influence. In this case, it will be we want to influence the government of Zambia. We want to influence as well donors that we seek funding to finance most of our budgets as well. Multilateral institutions like the World Bank, the African Development Bank. So this week has been eventful, and we are still rolling out most of the things. Like I mentioned, to say our report is now live. It's called Born Without Water, and if you scan it, you'll be able to have access to it. As well, we have a petition, and we have some placards and banners that even the young people from the Youth Wash Ambassadors Club are helping us mobilize with. Would like everybody to get involved, to sign this petition, to call for more investment, more attention and action to be taken around financing WASH in healthcare facilities. I will end my presentation here. Thank you so much for your kind attention.
Thank you very much, Angela, for shedding light. It's a touching story, isn't it? Great. So we'll break for 15 minutes to just have a breather and have some tea. And then after that, we get to our main event where we're going to engage more on this through the panel discussion to just cement the conversations and what we've heard from the submissions here to really reflect on gender and how that intersects with water. So thank you very much for your kind attention, and we should be able to be back at 10:50 exactly to kickstart our main activity. Thank you. This, when they get their teas, we're also invited to grab some teas. So the setting for the panel discussion now will face this side. So when we come back from the tea break, please, cameras and everything, it will be this setting this side, so you can already do your setting and things. So